Hello and welcome to your English News Bulletin. I'm Akivito and these are the headlines. Head of Epidemiology and Infectious Diseases at the Indian Council of Medical Research, Dr. Samiran Panda on Friday, warned that the third wave of the COVID-19 might hit the country by August end. The Nagaland Senior Citizens Helpline organized a seminar at the LCS building at Phulbari with various legal practitioners on Saturday in Kohima. Manipur Education Minister Sorokhaibam Rajan Singh has launched the Moodle Learning Management System for the government and government-aided colleges on Manipur on July 17th. And now the news in details. The Nagaland Senior Citizens Helpline organized a seminar at the LCS building at Phulbari with various legal practitioners on Saturday in Kohima. During the first session, Assistant Director at the Directorate of Social Welfare of Nagaland, K. Wangalang Sim, spoke. The resource person shared about the various government benefits for senior citizens besides speaking about old age pension disbursement, stating that the Good Samaritan Women's Society was selected by the Department of Social Welfare due to its credibility as a genuine non-governmental organization. He expressed confidence that the NGO will take the responsibility well. With regard to the programs and benefits given by the state, he said one of the platforms where benefits are being given to beneficiaries is through the National Service Assistance Program. According to the Social Welfare Department, senior citizens are categorized in two: senior citizens 60 to 79 years and very senior citizens 80 years and above. Wangalang Sim informed that the criteria for availing the benefits for senior citizen is that one should be above 60 years and should possess a below poverty line certificate. It was informed that Rs 200 per month are being given to senior citizens and Rs 500 to very senior citizens under the Old Age Pension Fund. In the afternoon session, Asin Lawaling, panel lawyer at the Kohima District Legal Service Authority, spoke on the focus, role and services being provided by the Legal Services Authority. She stated that the primary focus of the Legal Services Authority is not just to take up legal cases, but to educate and create awareness about the individual's rights and legal matters. Sanjeev Rana, retainer lawyer at KDLSA, while speaking on the topic Maintenance and Welfare of Parents and Senior Citizens Act 2007 during the third session, highlighted various amendments to the Act in 2011. He informed that parents include not only biological parents, but adoptive parents, grandparents, and also step-parents. And children include both biological, adopted, and stepchildren, including daughters and sons-in-law. Under this Act, recreation centers need to be set up for senior citizens to encourage peer interactions, while old age homes also need to be set up in all districts within the state, it was informed. As per the Indian Population Census 2011, the population of 60 plus of age people amounts to 57 million in 1991, which translates to 6.8% of the total population, while 76.6 million in 2001, which translates to 7.4% of the total population, and 103.9 million in 2011, which is 8.6% of the total population, it was informed. In an order passed by the Home Department, Government of Nagaland, regarding the attendance of government employees and staff, of all employee staff of the Nagaland Civil Secretariat and Directorate will be required to be vaccinated to attend office or produce a negative test either by RT-PCR, TrueNAT or CBNAT test every 15 days on self-payment. The salaries of all unvaccinated employees or employee staff who have not or failed to produce negative test results will be stopped beyond the 31st of July and they are not to attend office. The period of absence of such employees will be treated as leave without pay, the order stated. In the order, the government has asked the administrative heads of departments or head of departments to enforce the directive and has asked them to submit a report to the Home Department on or before the 15th of every month, giving the status of the vaccination or COVID-19 negative test report about employee staff and the salary deductions of employees availing leave without pay until further notice. Head of Epidemiology and Infectious Diseases at the Indian Council of Medical Research, Dr. Samiran Panda on Friday warned that the third wave of the COVID-19 might hit the country by August end.
Dr. Samiran Panda warned states that witnessed the low impact of the first two waves of COVID-19, cautioning that they might experience a severe third wave if restrictions are not maintained. Speaking to NI, Dr. Panda said that it is important for each state to examine pandemics and take a call regarding the COVID-19 situation there. There are states where the first and second waves of COVID-19 had a low impact, Panda said, adding that if the restrictions are not maintained now, then these states may be severely impacted by the third wave. There might be a third wave, as it is not inevitable, then a second wave. If the third wave happens, it will hit sometime around August end. It is not inevitable, Dr. Panda said, that the third wave of coronavirus may come around August end. When will the third wave come and how severe it can be? All these questions are related to many factors which are not known to full extent, he said. They say that the second wave is not over yet because there are fluctuations in the reported numbers of cases, and fluctuation certainly has to do with the tests conducted and the reporting mechanism, he said.
A pregnant healthcare worker identified as one Tamchi Kaku, who was working at the Chimpu PHC, succumbed to COVID-19 at Chimpu on Wednesday. According to reports, Kaku was 19 weeks pregnant at the time of her death. As a senior field worker at the Chimpu Health Center, she was engaged in COVID vaccination duty. Born in 1985 in Sarli, Kaku had tested positive for COVID-19 on 30th June. Informing about this in a release, the Tamchi Welfare Society stated that despite being pregnant, she valiantly continued to work and contributed significantly in the vaccination drive. Being pregnant, she had applied for leave from the medical officer of the Chimpu Health Center and also from the ICR DMO, the society stated. Without any complaint, she continued to work and ultimately made the supreme sacrifice with her unborn baby, the society stated. The TWS saluted her for making the supreme sacrifice for the people during the ongoing COVID-19 pandemic. Manipur Education Minister Sorokhaibam Rajan Singh has launched the Moodle Learning Management System for government and government-aided colleges on Manipur on July 17th. Speaking as a chief guest at the launch ceremony in the conference hall of the Directorate of Education, Rajan Singh said that the new initiative will help college students of the state a lot during the pandemic. He said the Moodle Learning Management System is a unique online education system which is simpler than other systems of learning. He said education is a sector which will need promoting with priority. Education at the school level is seeing more focus in comparison with higher education. The Education Department has geared up to secure an AAC score by the colleges of the state. Officials of higher education have been working to promote education in the state, higher education in particular. The minister maintained that teaching is one of the noblest professions. Teachers play the role of shaping the society by imparting knowledge and skills to the students, and for they are honored every year on the 5th of September for their dedicated service and responsibilities. If the education system fails, the whole generation will be lost, he added. Singh appealed to all the cooperate with the government's initiative to promote education in the state. Obstructions and agitation by students and teachers' organizations are hampering the teaching and learning processes of the schools and colleges. Such unwanted activities should be stopped, he added. The woman who was swept away in the Pari River near Balapu village of Toru Circle under Sagali subdivision in Arunachal Pradesh is yet to be traced as rescue operations entered its third day to locate the body. On Wednesday morning, a vehicle with two people fell into the Pari River near Balapu village. The driver of the vehicle miraculously survived the fall, but suffered serious internal injuries and was admitted to the Trihims in Naharlagun for treatment. Tragically, a 29-year-old woman traveling with him reportedly got washed away in the Pari River. Although the vehicle, a Mahindra Scorpio, from which the woman was washed away, has been pulled out of the river with the help of local divers, the body of the missing woman is yet to be found. The search operation, led by a joint team of NDRF, police, local people, well-wishers and relatives, had to be suspended due to darkness and will resume on Saturday, available information said. To fight the dowry menace, Kerala Governor Arif Mohammed Khan has suggested the Vice Chancellors of the universities in the state to make students sign a bond that they would not accept or give dowry before they are awarded their degree certificates.
Chancellors suggested that not only the students at the time of admission but also before giving them degrees must be asked to sign a bond consent, and all those who are being appointed in the university, they should also be asked to sign a bond consent. The signing of the bond should not be restricted to students, but also faculty members should be made to sign the bond. In the meeting with the vice chancellors of the universities, suggestions came up why only students, parents, but also at the time. If you want admission, you will have to sign the bond, the governor said. Universities cannot and should not allow their degree to be used as a license to increase the price of the bridegroom in the marriage market, the governor said.
After taking suo motu cognizance of the delay shown on authorities in releasing from jail people granted bail, the Supreme Court on Friday asked state governments to price it as to how many prisons in their territory have internet connections and by when jails will be equipped with facilities to ensure the expeditious release of prisoners. A three-judge bench of the top court, headed by Chief Justice of India, Nuthalapatti Venkata Ramana, and also comprising Justices A.S. Bopanna and L. Nageswara Rao, said it will soon devise a secure electronic transmission mechanism of its orders on bail so that it reaches the jail authorities in minimum time to facilitate the expeditious release of inmates who have been granted bail in a case. The court said that in the internet era, it seems that the jail authorities are relying on ancient modes of communication through pigeons. The bench also asked the Secretary General to consult amicus curiae, senior lawyer Dushyant Dave, and Solicitor General Tushar Mehta for trying to make some immediate arrangement of secure direct electronic mode of communication from Supreme Court to jails. The Supreme Court had also taken suo motu cognizance of delay in releasing convicts by prison authorities even after being granted bail by courts on Thursday. The Directorate of Revenue Intelligence busted a luxury car smuggling racket in Gurugram that had caused a duty evasion of more than Rs 25 crore by smuggling 20 vehicles into India in the name of diplomats and diverting the same to private persons.
People, including the CEO of a luxury car dealership, was arrested by the Directorate of Revenue Intelligence, said the press release. Operation Monte Carlo was launched after DRI received a tip-off that a group of individuals was involved in smuggling high-end luxury cars into India in the name of diplomats and diverting the same to private persons, thereby evading a huge amount of custom duty, according to the press release. It is pertinent to note that the government grants exemption from custom duty to certain classes of members of diplomatic missions in India and their family members on all imported goods. The net customs duty on import of cars work out to 204% according to Regulation of Custom Privileges, Rules 1957. A total of 6 cars have been detained under the provision of Customs Act 1962. More cars have been identified and are in the process of being located. A Dubai-based individual who has been involved in past customs offences and has been investigated by DRI was the mastermind behind the racket. The domestic registration for these vehicles would be done in certain specific regional transport offices in Maharashtra, Himachal Pradesh and Punjab.
After about 2 months of stoppage, railway services at the Dimapur railway station have resumed from July 17. The state government had halted railway services due to the increase in the coronavirus infections. As the services resumed, 187 passengers were tested at the station, out of which one person tested COVID-19 positive, updates informed. After a brief confusion regarding Europe's travel guidelines for vaccinated Indians, France has finally eased travel restrictions and allowed entry of those who have taken Serum Institute's Covishield, the Indian-made version of AstraZeneca vaccine against coronavirus infection. However, France has announced various other restrictions to tighten its borders against the spread of the Delta variant. The change in travel guidelines came after a huge outcry regarding the European Union's certification of COVID-19 vaccines that recognized only AstraZeneca vaccines manufactured in Europe. France still does not recognize the Chinese or Russian vaccines, only those authorized by the EU drug regulator, that is those developed by Pfizer BioNTech, Moderna, Johnson & Johnson or AstraZeneca. Being one of the world's top tourist destinations, the French Health Ministry recently revised its COVID guidelines in view of the third wave warning and to curb the spread of the Delta variant cases. As a result, France has made it mandatory for anyone arriving from Britain, Spain, Portugal, the Netherlands, Greece or Cyprus who is not fully vaccinated to present a negative RT-PCR test taken within 24 hours. According to France's travel rules, a fully vaccinated individual is considered after 1 week of receiving the second dose. The wait period to be considered vaccinated was 2 weeks earlier. Meanwhile, Tunisia, Indonesia, Cuba and Mozambique have been added to France's red list of countries with high COVID positivity rates. The manifestation of post-COVID-19 complications in a number of patients is fourfold higher in the second wave as compared to the first wave, a study by Apollo Hospitals has revealed.
COVID cases are referred to instances where patients suffer some COVID-related complications for longer duration, and these cases have surged. The Delta variant that caused havoc this year in April caused extreme casualty, and the later was termed as virus of concern by the Union Health Ministry. So, newer symptoms like high-grade fever, diarrhea, severe lung infection followed by long COVID syndrome, and post-COVID complications like falling oxygen levels and lung fibrosis that manifested even after 8 weeks or more of testing positive. The study reads, number of cases reported for long COVID and post-COVID complications after the second wave of COVID-19 has been 4 times more than what was reported the previous year, it says. Patients were admitted after 20 to 30 days of testing positive. Known as long-haul COVID cases, these patients continue to experience symptoms of the disease 4 weeks post the initial recovery. Many patients are being reported with complications such as breathlessness, prolonged weakness, extreme fatigue, recurrent headaches and fever, lung fibrosis, and increased pulse rate, various gastrointestinal issues, and some uncommon complications like erectile dysfunction, hair loss, and menstrual disturbances in women. Being immunocompromised, some patients were also suffering severe post-COVID complications like mucormycosis and secondary infections. Recovery for such patients is taking an extended time than expected. India reports 38,079 new cases and 560 deaths in the last 24 hours. Active case load at 4,24,025. Recovery rate rises to 97.31%.
Union Home Minister Amit Shah on Saturday said all gaps on India's border fences will be covered by 2022 to ensure comprehensive security. He said before the Narendra Modi government came to power, India lacked a national security policy which now aims at paying the enemy back in the same coin. Shah said nobody wants to leave gaps in the fences, but if on a 200-kilometer long fence one leaves a gap of 1.5 kilometer, the entire stretch of the fence becomes useless, he said. He said to have worked on filling these gaps by removing roadblocks at the administrative level and even spoken to the neighboring countries, the Home Minister stated. Surmounting all difficulties, he assured that before 2022, there will be no gaps left in India's fencing, Shah said. Shah was delivering the Rustamji Memorial Lecture at the investiture ceremony organized by the BSF at Vigyan Bhavan. Shah said even before he came into politics, he always thought about border security. Devastating floods have torn through entire villages and killed at least 153 people in Europe. 133 of them in Western Germany, where stunned emergency services were still combing to the wreckage on Friday. Unsuspecting residents were caught completely off guard by the torrent up the flood of death by German newspaper Bild. Streets and houses were submerged by water in some areas, while cars were left overturned on soaked streets after flood waters passed. Some districts were completely cut off. Everything was underwater within 15 minutes. Agron Beriska, a 21-year-old decorator from Bad Neuenahr in Rhineland-Palatinate state, told AFP. In nearby school, Hans-Dieter Wranken, 65, said caravans, cars were washed away, trees were uprooted, houses were knocked down. Roger Levens, Interior Minister for Rhineland-Palatinate, told Bild that that toll was likely to rise and emergency service continued to search the affected areas over the coming days. And this was all for the eye. For more news and latest updates, stay tuned to HornbillTV.